What if the picture of perfect health your cat or dog projects is actually hiding, well, a silent saboteur?
Hmm.
We're talking about hemoplasmosis today,
Yeah.
a condition you might not have heard of, but one that can sneakily lead to anemia in our pets.
That's absolutely right. We're doing a deep dive into hemoplasmosis, which people used to call hemobartonellosis, something that often operates under the radar. But it can really impact the well-being of cats and dogs.
And our goal today, drawing from the expert insights in feline and canine hemoplasmosis management, is basically to get a clear picture of this condition. But without getting totally bogged down in, complicated medical terms,
Right.
we want to understand who's most at risk, what the key warning signs are, and how it's typically managed.
Mhm.
Okay, so let's unpack this. What exactly is hemoplasmosis?
Well, at its core, hemoplasmosis causes anemia, so a shortage of red blood cells. This happens when these tiny parasitic bacteria, mycoplasmas they're called, latch onto the surface of the red blood cells. They essentially scavenge from these cells, and this process triggers the pet's own immune system to start destroying the infected red blood cells.
So it's like a double whammy.
Exactly. The parasites cause damage, and then the immune system adds to it by attacking the cells.
So these little organisms are freeloading and causing the body to turn on itself. That sounds definitely problematic. Let's talk about who is most susceptible. Are certain pets more likely to get this?
Absolutely. Yeah, there are patterns. If we look at cats, the acute form, the one that comes on, suddenly it tends to be more common in younger male cats.
Younger males, okay.
But interestingly, the chronic form, where the infection kind of sticks around long term, that's more often seen in adult male cats.
Huh. So gender seems to play a role there, at least in cats.
It does seem that way in felines.
What about dogs? Is the risk profile similar?
For dogs, it's a bit different. Acute disease is definitely a bigger concern in dogs that have had their spleen removed, splenectomized dogs.
Right, the spleen's important for immunity.
Exactly. So its absence really changes things. Now, for the chronic form, that's generally seen in dogs that still have their spleen. And there's this specific finding, too. Kennel-raised beagles seem to have a higher risk of infection.
Kennel-raised beagles, that's very specific.
It is. But unlike cats, we don't really see a particular sex being more prone in dogs overall.
That beagle detail is fascinating. Makes you wonder, doesn't it? About kennel environments or maybe even a breed predisposition.
It certainly raises questions.
Okay, so if these mycoplasmas are causing trouble, what signs might you, as a pet owner, actually notice? What's a red flag?
The signs can really vary, especially in cats with Mycoplasma Haemofelis. That one tends to be the most troublesome. In acute cases, you might see pretty severe anemia, and sadly, it can even be fatal sometimes.
Wow.
And what's really interesting here is that fever isn't always present. It kind of comes and goes, maybe only happens about half the time.
Only half the time. That makes it tricky.
It does. Other things to watch for are, well, your cat seeming depressed, weak, maybe losing their appetite. Also, pale gums, a noticeably enlarged spleen, and sometimes even jaundice, that yellowing of the skin and eyes.
That's quite a list, and the intermittent fever definitely makes it harder to pin down immediately. What about the other types you mentioned, like Candidatus M. hemomenutum in cats? Do they show similar signs?
Generally, no. Infections with Candidatus M. hemomenutum are usually much more subtle. Often, there are no obvious signs at all, and they tend to have minimal impact on the red blood cell count.
Okay, less severe then.
Yes. And for Candidatus M. turicensis, well, there's less information, but experiments showed it can cause moderate anemia in cats.
So it really matters which mycoplasma it is, especially for cats.
Absolutely. The specific type really influences how sick the cat might get. Identifying which one, if possible, is quite useful.
So it sounds like M. Haemofelis is the real problem maker in cats. What about dogs? What signs might dog owners see?
In dogs, often the signs are quite mild, or maybe even non-existent. Perhaps just pale gums and being a bit listless.
Subtle.
Very subtle. Unless, that is, the dog's spleen isn't working well or has been removed, then they're much more likely to show obvious signs of illness.
Ah, the spleen again.
Right. And we also need to remember those high rates of silent chronic infections in those kennel beagles. A seemingly healthy beagle could still be carrying the organism, which can complicate things, even skew research results.
Like a hidden reservoir of infection. Okay, we've covered who's at risk, what signs to look for. Let's dig into the why. What exactly causes hemoplasmosis, and what factors can make it worse?
Well, the direct cause is infection with these hemotropic mycoplasmas. As we mentioned, they used to be called Hemobartonella, but now we know they're bacteria. The main players are Mycoplasma Haemofelis and M. haemominudum in cats and M. haemocanis in dogs. So yeah, a bacterial infection targeting red blood cells.
And we heard that some are worse than others.
Exactly. In cats, M. haemofelis generally causes more severe disease than M. haemominudum. And here's a really critical connection. Cats that are also infected with feline leukemia virus, FLEV, they tend to get much more severe anemia if they also get
Oh,
hemoplasmosis.
wow. So FEL-EV makes them more vulnerable.
It seems that way, like having a weakened baseline. And for dogs, the risk of severe anemia really climbs if their spleen is removed or, diseased. The spleen is just so key for the immune response and clearing abnormal cells. If it's not working right, the body's less equipped.
That makes total sense. A compromised immune system or missing that filter.
Yeah.
Yeah. Okay, so if a pet owner suspects something's wrong, how does a vet figure out if it is hemoplasmosis and not something else?
Yeah.
What's the diagnostic process like?
Diagnosis usually starts by ruling out other causes of what we call hemolytic anemia. That's anemia where red blood cells are being destroyed too quickly.
Right.
So in dogs, we think about things like autoimmune hemolytic anemia, AIHA, where the body attacks its own cells.
Yeah.
Also, babesiosis, a different parasite. In cats, cytozoonosis, another protozoal disease, is a concern. And Heinz body anemia, where red cells are damaged, that's possible in both.
So a lot to consider. How do vets actually tell hemoplasmosis apart?
Well, the key difference, especially distinguishing it from AIHA, is actually seeing the mycoplasma parasites in the blood. This can be done using special stains on blood smears looked at under a microscope, or by using PCR tests.
PCR.
Polymerase chain reaction. It's a very sensitive test that detects the bacteria's DNA, even tiny amounts. And importantly, a pet can actually have both AIHA and M. haemofelis at the same time. That definitely complicates the picture.
Oh boy. Dealing with two different attacks on the red cell.
Exactly.
You mentioned babesiosis and cytozoonosis too. How are they different?
Good point. They're important to differentiate because they're caused by protozoa, not bacteria like mycoplasmas. They just look different under the microscope.
Okay, different type of organism.
Right. And Heinz bodies, those are identified with specific stains highlighting damaged hemoglobin inside the cells. For other rare causes of anemia, like certain enzyme deficiencies, there are specific enzyme or DNA tests. So it really requires a thorough workup.
Sounds like it. What about just standard blood work? The CBC, what does that tell us?
A CBC or complete blood count usually confirms there is anemia. Often, it also shows signs the body's trying to compensate by making new red blood cells. That's called reticulocytosis. Think of it like the bone marrow going into overdrive.
Okay, trying to keep up.
Exactly. But if the anemia came on very suddenly, or if there are other infections like FLV or FIV in cats, you might not see that response right away. Also, a little technical point, cat blood can sometimes clump if it gets cold, which the lab needs to know.
Good to know.
And unfortunately, the white blood cell counts. They don't usually give us much specific help for diagnosing hemoplasmosis itself.
Are there other clues in the blood or urine?
We rarely see free hemoglobin, the stuff inside red cells floating in the blood. And it's not typically found in the urine either with this condition. We might see a mild increase in bilirubin, though, which causes that jaundice pigment.
Okay.
And in really sick cats, or if the blood sample isn't processed quickly, you might even see low blood sugar.
Right, so the CBC paints a picture, but finding the actual mycoplasma seems key. How's that done?
Exactly. Vets use special stains, like rate gemcis stain, on blood smears. They're looking directly for the mycoplasmas on the surface of the red blood cells. It's really crucial to do this before starting treatment,
Why before?
because the organisms can actually detach from the red cells in stored blood samples, especially those collected in EDTA tubes, the common purple top tubes.
Ah,
Also, the standard stains used to look for those young red cells, reticulocytes. They aren't great in cats because the reticulocytes themselves can look really similar to the mycoplasmas.
so it takes a keen eye.
Definitely. You need to know what you're looking for and be able to tell the parasites apart from, staining artifacts or other things on the slide.
What do they actually look like under the scope?
In cats with M. haemofelis, they often look like small blue dots, maybe rings, or short rod shapes stuck onto the red cells. You might see quite a few. With Candidatus M. haemominudum, you usually see fewer, and they tend to be smaller rods or almost round, cocoid shapes.
And the third cat one.
Right. Candidatus M. turacensis isn't typically seen on blood smears, interestingly.
Okay. And dogs.
In dogs with M. Hemocanis, the organisms often form chains or sometimes long, thread-like filaments on the red blood cells.
They sound pretty distinctive if you can spot them,
hmm
but the source mentioned they can be a bit sneaky.
They absolutely can. The number of parasites in the blood, but the parasitemia, it can fluctuate. It goes up and down in
All
cycles.
cycles.
Yes. So even if a pet has hemoplasmosis, the organisms might not be visible on a blood smear at any given moment, particularly in cats.
So a negative smear doesn't rule it out.
Exactly. A single negative smear isn't conclusive. Which brings us back to the value of PCR testing.
All right, the DNA test.
Yes. As we said, PCR can detect even tiny amounts of the parasite's DNA, even when you can't see them under the microscope. It helps catch those infections where the parasite load is low or cycling down.
So PCR can catch them when they're hiding. Are there other tests needed sometimes?
Well, if the anemia isn't showing those signs of regeneration, if the bone marrow doesn't seem to be responding, then a bone marrow sample might be necessary. That helps look for other underlying problems affecting blood cell production.
Makes sense.
And critically, the source strongly advises PCR testing for all blood donors. This is vital to prevent spreading hemoplasmosis through transfusions.
That's a really crucial point for protecting other animals. Okay, so we've found the culprit. What can be done? What's the treatment approach?
Well, without treatment, M. Haemofelis in cats can be fatal in up to 30% of cases, so timely treatment is really important.
30%, wow.
Yeah. In most situations, treatment can be done at home, unless, of course, the pet is severely anemic or just very, very ill. If the anemia is life-threatening, then blood transfusions are definitely needed to stabilize them. And really sick animals might need hospitalization for IV fluids, sometimes with glucose added for energy.
Okay. And what about medications? Are there specific drugs?
Yes, the main treatment is antibiotics from the tetracycline family, so doxycycline, tetracycline itself, or oxytetracycline. These are usually given for at least 3 weeks, sometimes up to 6 weeks, to really try and clear the infection.
3 to 6 weeks, okay.
There's also some early research suggesting another antibiotic, enrofloxacin, might work in cats if given for about 2 weeks. So antibiotics are the cornerstone.
So the antibiotics fight the infection. What about dealing with the anemia itself?
Good question. For severe anemia, corticosteroids like prednisolone might be used. These drugs help suppress that immune system attack on the red blood cells, giving the body a chance to recover. The dose is usually tapered down as the red cell count improves.
Steroids to calm the immune system. Got it. Are there important side effects or warnings with these meds?
Yes, definitely things owners need to know. Doxycycline can sometimes cause issues in the esophagus in cats, like irritation or strictures.
Ouch. How do you avoid that?
It's usually recommended to give it with a bit of food or follow the pill with a small amount of water just to make sure it goes down smoothly and doesn't get stuck.
Okay, good tip.
Other tetracyclines might cause fever or some stomach upset in cats. And with enrofloxacin, high doses can potentially cause eye damage in cats, so sticking to the vet's prescribed dose is essential.
Eye damage. Okay, definitely follow instructions.
Absolutely. And one critical warning, the antibiotic chloramphenicol should never be used in cats for this. It can seriously harm their bone marrow and red blood cell production.
Wow, okay. That's a vital piece of information. Good to know. So treatment's done, pets hopefully improving. What's the follow-up like?
Typically, the vet will want to recheck the pet after about a week of treatment, mainly to monitor progress and make sure that red blood cell count is heading in the right direction, starting to rise.
That makes sense.
It's also important for owners to realize that cats, even after successful treatment and getting back to a normal red cell count, can sometimes remain carriers of the mycoplasmas.
So they still have it, even if they seem fine.
They can, yes, but the good news is they usually don't get sick again once their red blood cell count is stable. And interestingly, it seems cats develop some immunity, some protection, against getting M. Haemofelis again for a while after they recover.
Oh, that's good. Like their immune system learns to handle it better.
Seems that way. It remembers the encounter.
That's reassuring. Well, this has been a really thorough deep dive into hemoplasmosis. Let's quickly recap the key takeaways for you, our listener.
Yeah, basically, hemoplasmosis is a significant, though often hidden, cause of anemia in cats and dogs. It's caused by these parasitic mycoplasma bacteria. The signs can really vary, and factors like age, maybe sex in cats, and definitely spleen health play a role in risk and severity.
And diagnosing it takes careful work, often needing specific blood stains or those sensitive PCR tests.
Right. Early detection and the correct antibiotic treatment are really crucial for a good outcome.
Absolutely. And if you notice any of those signs we discussed, lethargy, pale gums, especially in your cat or dog, please consult your veterinarian promptly. Timely diagnosis and treatment are key.
You know, this whole discussion raises a really interesting final thought. Given that these infections can be silent, especially in places like kennels, what broader impact might this have on the health of animal populations overall, or even on research studies that use animals from these settings?
Mhm.
It really highlights the complexities of infections that can lurk beneath the surface, doesn't it?
That's a really thought-provoking point to leave everyone with. The hidden world of silent infections. Thanks for joining us for this deep dive into hemoplasmosis. Until our next exploration, keep those curious minds active.